Welcome to this comprehensive class member transition program policy training provided by the UIC College of Nursing. This training will address the special processes of the comprehensive program. This training will enable comprehensive program staff to understand the special processes included in the comprehensive program and correctly complete and submit the associated documents. Staff credential requirements. Policy P0.04. Per Policy P0.04, both the Williams and Colbert consent decrees specify the level of training and credentials required for certain elements of the comprehensive program. In addition, it is important that program staff and partners are aware of the staff performing each role at an agency and how they can be contacted. Prime agencies should maintain a complete and accurate list of staff involved in the comprehensive program activities. This list should be provided to the comprehensive program when requested. In addition, UIC and comprehensive program staff should be notified of any staffing changes to ensure appropriate access to the web app is maintained and staffing gaps are identified at the program level. Staff credentials, particularly for staff completing assessments and service plans, should be maintained within the web app. Individual staff should ensure their credentials are accurately reflected. Prime agency assignments and transfers, Policy P0.03. Class members who have already transitioned into the community remain assigned to the agency responsible for the transition, except where transfers, as outlined in Policy P0.03, are approved. Transfers can take place following a class member's request, when a class member transfers between facilities, or, with the class member's consent, when arranged between two prime agencies directly. All proposed transfers must be communicated to IDHS and UIC-CON in advance. IDHS will approve transfers on a case-by-case basis. Transfer proposals should be emailed to the prime agency's assigned OMSU support unit auditor. Facility concerns, Policy P6.2. A goal of the comprehensive program is to minimize barriers to class member transitions. Prime agencies should work with nursing facilities and SMRFs to reduce barriers to member transitions, but where those barriers cannot be resolved with the facility, these should be communicated to IDHS. After attempting to rectify the barrier directly with the facility, if it cannot be resolved, the prime agency must take several reporting steps. The agency must contact IDPH through their hotline or via the reporting website listed here. The agency must report the event to the Long-Term Care Ombudsman via phone, TTY, or electronically. The agency must also immediately email Comprehensive Program Quality Assurance staff detailing the concern. The agency must also email Comprehensive Program staff detailing the concern. The report must include the name of the reporter, the organization or agency the reporter is affiliated with, the class member's report of the situation, the date of the event and the type of concern, the summary of the event that took place, the facility's name and address, and a confirmation that the issue was reported to the Ombudsman and to IDPH. The completed form must be submitted via email to both IDHS and IDPH staff as identified in Policy P6.02. Comprehensive Program staff will address the concern directly with IDPH. Serving members with no income, Policy P6.03. Because members require financial stability in order to function in the community, all class members are eligible to receive SOAR services, Social Security Outreach Access and Recovery, to assist them with obtaining sustainable income. When a class member is determined to have no income, the prime agency will explore available options for income. Some of these options include full or part-time employment, support from family, VA benefits, retirement benefits or pensions, and supplemental security income, SSI, or Social Security Disability Income, SSDI. If the class member is unable to independently obtain a source of income, the prime agency will explain SOAR services to the member and complete the SOAR Accept Decline letter. The SOAR letter explains the purpose of the SOAR program and documents the member's consent to the process. If the member is not interested in receiving SOAR services, the reason for their declination should be documented here. This document should be submitted following the document submission policy. If the class member declines SOAR, they will not receive SOAR services, but the prime agency should continue to explore alternative income options as appropriate. If the class member accepts the SOAR process, the prime agency's SOAR staff should begin to gather the documents required to complete the SOAR application. SOAR staff will explain the model and the staff's role to the member. This includes supporting a collaborative process, with the class member assisting in the completion of their Social Security application. The SOAR staff will complete the medical summary report. This is a document that integrates all of the information from the person's medical records, one-to-one interviews, and interviews with family, friends, and other supporters into one cohesive document to assist with the disability determination process. SOAR staff will also facilitate communication between the class member, their case managers, IDHS, and the nursing facility or SMRF, the Social Security Administration, Disability Determination Services, and other providers. SOAR staff are tasked with providing assistance to SSA and DDS in the process of determining the class member's disability status. Staff will also keep the class member and comprehensive program staff abreast of the application process. The SOAR application can take some time to be developed and submitted, as it involves the synthesis of quite a lot of clinical information. During that time, and while waiting for the application to be processed, the prime agency should continue to work on pre-transition tasks identified in the Comprehensive Service Plan. Some of these tasks may include skill building related to medication administration or other functional tasks, obtaining DAWN scores, or beginning to coordinate waiver services, as well as referring the member to additional services or supports, including substance use treatment or education or employment resources. The goal is to continue to prepare the member for transition so that when they do obtain income, they can proceed to the housing search process without delay. When the class member is awarded funding, the prime agency can begin the housing search, looking for apartments or other housing options, and proceeding towards transition. If the class member's application is denied, however, SOAR staff will help the class member file an appeal with SSA, and the agency should continue to provide the member with pre-transition engagement and support services. Neuropsychological testing and exclusionary criteria evaluation. Policy P6.04. A neuropsychological assessment consists of the administration of neuropsychological tests for the formal assessment of cognitive function, including mental status, orientation, memory, intelligence, language, and executive function. In the comprehensive program, these assessments are conducted to assess the member's cognitive functioning, and class members are eligible for a neuropsychological assessment to help determine if they can safely live in a community setting and what services and supports may be needed to do so. The program also offers exclusionary criteria desk reviews for Colbert class members who may have severe dementia or another clinically significant and progressive cognitive disorder, and who, per the terms of the consent decree, may be excluded from outreach or assessment activities. If a prime agency feels that a class member may benefit from a neuropsychological assessment or exclusionary criteria evaluation, they will discuss this with the member and provide the member with a neuropsychological assessment flyer, documents 6.6 and 6.7. If the member agrees to the assessment, the agency will have the member sign the IDHS consent form, document 6.5. This includes class members identified at other points in the transition continuum. After the consent form is signed, the prime agency should complete the neuropsychological referral form, document 6.4, for the class member and submit it along with the signed consent form. This should be sent via encrypted email to the email address in the policy. The neuropsychological evaluation referral document is a document which identifies the member, their care management staff, and the reason that the assessment is being requested. It should be submitted following the document submission process. The IDHS consent form authorizes the release of information from the nursing facility to the prime agency and the UIC Department of Psychiatry, who will be conducting the neuropsychological assessment. This is a complex document that must be filled out correctly. The document is authorizing the prime agency to both disclose and obtain records. At minimum, the boxes for social history, history and physical, treatment plans, assessments, and physician's orders should be checked. The specific date range should be 3 to 6 months and can be provided as a specific range of dates. Include the class members' identifying information here. The purpose of this authorization is for continuity of care and a potential placement transfer. The Disclose To box should be checked and completed with the UIC Department of Psychiatry's information. The Obtain From box should be checked and contain the nursing facility or SMRF's information. The authorization should be valid for no more than 1 year. Do not check any boxes under Item 8 unless the class member specifically insists on having certain information withheld from the release. The member, their guardian if applicable, and comprehensive program staff should sign at the bottom of the page. The comprehensive program staff at IDHS will schedule the class member's appointment with the USC Department of Psychiatry. These appointments are scheduled based on the department's availability, so IDHS cannot predict when a particular appointment will be scheduled. When the appointment is scheduled, IDHS staff will send letters to the class member, nursing facility or SMRF, and the prime agency containing the appointment details. The prime agency should follow up with the member and with the facility to ensure they are prepared for the appointment. There should be ongoing communication between the prime agency, SMRF, and the class member from the date the appointment is scheduled through completion of the evaluation. The nursing facility or SMRF is responsible for arranging transportation and providing an escort to the appointment, as well as providing any records needed to facilitate the appointment. After the testing appointment, it may take some time for the final assessment report to be completed. When it is, UIC Department of Psychiatry will send the report to IDHS staff. IDHS will forward the assessment onto the prime agency, who is responsible for communicating the outcome of the assessment to the class member. Prime agencies should use the results of the neuropsychological assessment to guide service planning and the next steps in the member's transition. However, the neuropsychological assessment is not controlling as to the level of care or service needs and should be interpreted in conjunction with all available assessment data. If the class member will no longer be proceeding as a result of exclusionary review, the results must be entered into the web app. If the findings indicate the class member meets criteria and will no longer be proceeding towards transition, this must be entered into the web app through the No Longer Proceeding feature. Policy P6.07, Quality of Life Survey. A core premise of the comprehensive program is that many class members who reside in long-term care facilities would like to live in the community if they could, and believe a successful community transition would improve their quality of life. UIC-CON administers a quality of life survey by telephone with each class member at the time of their transition to the community, reflecting their experience while residing in the facility, and after they have lived in the community for 1 year from their transition, reflecting their community experience. Policy P6.07, Quality of Life Survey, describes the purpose and procedures for the survey. Current versions of all comprehensive program policies and forms, as well as educational resources, can be found on the Colbert-Williams training website, managed by the UIC College of Nursing. Any questions can be directed to the Colbert-Williams Help Desk email listed on that website. Thank you for your attention and efforts to ensure safe and successful member transitions.